Binocular vision is our ability to use both eyes together in order to track objects. Basically, it's the ability of our brain to use our eyes together to process information effortlessly.
For most people, this happens naturally, but for some, it's anything but natural.
Children who struggle with reading is a big one. If you think about what we have to do to read, there's a number of things that have to happen efficiently and properly. We have to be able to pull the eyes in together, and we have to be able to move from side to side whilst converged. That's actually a pretty demanding task on the muscles.
Binocular vision makes it difficult for children to read and can cause huge problems retaining information, even when they're being read to. That's because there is more to reading than eyesight. There's short-term memory and pattern recognition. Unfortunately, binocular vision issues are not always caught early.
As part of routine eye exams, we are taught to do the basics, and a lot of that stuff is done quite well. I think it's quite easy to mistake because, for example, if you have a problem pulling your eyes in together, first of all, it's not visible. It's not something that people see. The reason why these things tend to get missed a lot is because, first of all, the patients actually tend to see clearly. So you put up the eye chart, they can see a lot of the time. So it can get missed, and a lot of the symptoms are often attentional based or headache based.
As a result, those with binocular vision deficiency tend to be labeled as something else, like a behavior disorder such as ADHD. If your child is having problems reading and retaining what they've read, then bring it to the attention of your eye care specialist. And it's worth knowing that treatment doesn't necessarily mean surgery.
Some patients, for example, have eye turns, lazy eyes. You see these people wearing patches. There is an area that is becoming more and more accepted called vision therapy for symptomatic convergence insufficiency. So the inability to pull my eyes in, which is by far the most common condition. That treatment via in-office therapy reinforced by home therapy is highly effective.
So what about prevention? It all comes back to the eye exam. A good rule of thumb, by the time a child has their first birthday, they should have their first eye exam.
And a lot of people are surprised to hear that because they say, well, how can you ask questions to a one-year-old? You can't say better one, better two with a lens with a one-year-old. But you can spot very important things like if the eyes are beginning to turn, if they have a different colored pupil. But most eye turns, for example, inward eye turns, usually start anywhere between about 4 to 6 months of age.